Today I'm going to talk about a marker called Lp(a). On paper it looks like big L, little p, and then little a in parentheses. And this is a cardiovascular marker that sometimes can come along with drawing a cholesterol panel, but it's not routinely checked. So you may have known for years that you have high cholesterol, but this number you may be completely unaware of. Or you can even have normal cholesterol, but have a high Lp(a). So it's important to know about this, especially if you have a family history of heart attacks or heart disease, or if you've been told your cholesterol is high, or even if you're in menopause. Those are the 3 reasons that I commonly tell people to check, but I don't think it's a bad idea to just check anyways, just to see if you have this risk factor, because Lp(a), if elevated, puts you at a lot higher risk for heart disease. And about 1 in 5 of the population here has high Lp(a). Most of it is genetic, so about 90% of people with elevated Lp(a) is because of their genes, not because of what they've been doing. So there's not a lot that we can do to modify this if you have it high, actually to modify the number itself or your propensity to have high Lp(a), but what we can do is really focus on how do we prevent heart disease from all other angles so that we are not seeing heart disease in somebody with Lp(a). I always tell people it's important to check and know your risk in certain instances, but it doesn't mean that you let this risk define you or that you think, okay, I'm doomed because I have this marker. Not at all. But we want to know how aggressive we want to be and what to look out for to prevent heart disease. So Lp(a), how to think of this is think of your LDL cholesterol, and this is something that you probably have had checked before, as a very clean sphere. But Lp(a) is your sphere, but with a little tail or a little corkscrew at the end. So the corkscrew then is stickier, more inflammatory, and it can stick to your cardiovascular walls of your arteries and cause more risk for blockage or plaque or clots. And so it's thought that even high Lp(a), you're at 6 times more risk to develop these things than if you did not have a high Lp(a). So what do you do if you've had your labs tested and you know you have this high marker? It's important to know that there are not medications or treatments right now that lower it. In fact, statin medication increases it. There are some supplements out there that are being studied, particularly niacin. Niacin is a B vitamin that if you've ever taken it and taken it at high doses, you may have had an experience with it. It can cause you to flush and look like a tomato and feel really weird for about 30 minutes after you take it. That's niacin. Studies are showing that in high doses, niacin can help lower Lp(a). But those studies are still out there. That is a good tool that we have, though, and something worth considering discussing with your medical provider. But my angle really with this is to also support cardiovascular health from a foundational level. And this is really something I think that everybody should be doing. But if you know you have this high marker, then you really need to make this a priority. And again, these are the basics. So we want to decrease inflammation because inflammation plus high Lp(a) equals more risk for cardiovascular disease. And inflammation can bump up Lp(a). So how do we decrease inflammation? We want to make sure that we are eating a clean and healthy diet, that you're not getting a bunch of inflammatory foods in your diet, like processed foods, lots of sugar. We also want to make sure that your blood sugar is at a healthy range and that your insulin level is at a healthy range. Because when you start to get higher blood sugar levels and higher insulin levels and trend more towards diabetes, that is a huge risk factor for cardiovascular disease. The worst thing that you want to do is have high Lp(a) and diabetes. So we want to get those blood sugar levels down. And then also look at things like optimizing your blood pressure, making sure that you're sleeping well, making sure that you're exercising. Again, all of the foundational health things. So with Lp(a), when do we check? It is a normal blood test, so you can have it checked at any time, but especially if you have a family history of heart disease, or if you have been told your cholesterol is high, or if you're in menopause. And the reason I mentioned that population is because if you're in menopause, your Lp(a) statistically can increase at that time. If you get this checked and you have this number that's high, it's good to track probably at least once a year. Again, work with your medical provider, but that'll help you understand, are you making any progress? Is this number going up? But also important to check your full lab panel to make sure that your blood sugar is optimized, that you don't have any nutrient deficiencies, and just all of, again, the foundational things that we want to make sure that we're taking care of. So again, if you have high Lp(a), don't fret, but just use this as a tool to be proactive to prevent you from getting heart disease.